Welcome back to the WHHI News. Do you know what AFib means? We're going to find out and about some ways to treat it, diagnose it. Joining me now is Dr. Mintu Turakhia and also a AFib patient advocate, Mellanie Truehills. I want to ask you first if you can explain what is AFib. I know atrial fibrillation, but what exactly is it?
Certainly. Atrial fibrillation, or AFib as it's commonly called, is an irregular and often very fast heart rhythm disorder. Some people are aware they're having it the minute they go into it. It feels like palpitations, a fluttering heart. Some people get short of breath, they get lightheaded, but sometimes patients are unaware of it. Maybe it's a little fatigue or they're getting winded, but they don't think anything of it. Some feel absolutely nothing. And this is really subtle in the early stages because AFib comes and goes. The real issue is that anyone can develop it. The risk goes up with age, especially age 65 and up. And there's also other contributing factors that create risk, like high blood pressure, being overweight, diabetes, just to name a few. Now, in the US, there's
I'm sorry,
yes.
Why is this important to diagnose? Can it lead to other health issues?
Absolutely. In the US, we have 1.5 million undiagnosed, 3 to 6 million total. But the issue is that even if you're not aware you have it, it can increase your risk of stroke or related heart problems like heart failure. And because it's treatable with modern therapies, drugs, procedures, blood thinners, it's why early detection is so important. And in order to do that, you need the right tool to diagnose. In the medical world, that's an electrocardiogram, an ECG, an electrical photograph of your heart. And as you know, it wasn't that long ago that you had to go to a doctor's office like mine or the ER, and we connect you with wires to this big box. Now that's all been miniaturized, and it can come directly to your home. And so our iRhythm Zeo monitor is one such technology where it's a patch placed on the chest. After prescription, it records continuously for up to 14 days and lets your doctor make that diagnosis or give you peace of mind that you have normal rhythm.
Amazing. Everything gets easier and smaller as we go along, which is great. Mellanie, let me ask you, you are the advocate. It is National AFib Month, I believe. What happened to you?
So I was diagnosed in 2003. I was just working at my computer, and all of a sudden my heart took off racing and skipped some beats, and I was short of breath. And at the emergency room, they said I had AFib, and I'd never heard of it. But AFib was scary. It totally took over my life. I was afraid to go anywhere by myself for fear that I would have a stroke. But I had a procedure, and I've been AFib free for 19 years. I started stopafib.org to help other people who were dealing with this terrible condition to, get their lives back and to figure out how to get under control. I created AFib Awareness Month to raise awareness of AFib and to get people diagnosed and treated before they have a stroke or develop heart failure.
That is such a great resource, and we do have that website up on the screen. And Doctor, if I can go back to you, the technology you're talking about now that you would wear for a while, is that known as the Band-Aid, or am I thinking of something else?
Well, they come in several forms. There's several companies that have them. We have ours. It's called the Zeo monitor, and it looks like a large bandage, and it goes right over your heart approximately. And again, it's a continuous 14-day recorder for an ECG. When you have a diagnosis or a condition like AFib that comes and goes, sometimes that single ECG, whether it's on your watch or in your doctor's office, isn't going to be enough. And that's why that continuous recording can be so important.
So what do we do the same thing in all cases? If I come in and I have AFib and somebody that's 80 that has AFib, or is it really tailored to age, to health condition? How do you decide what to do?
Yeah, I think the key is our goal here is awareness, right? So not everyone needs heart monitoring, but the point is if you have symptoms that could be AFib, it's worth talking to your doctor. It's worth going to stopafib.org, the website, to determine if you are truly at risk and whether a diagnostic test is needed. And then you can work with your doctor to have that conversation of what the right tool is. Like you said, it may be different, and nothing may be necessary, or you may have to even probe deeper. The goal is to get to diagnosis or rule it out so you can guide therapy.
Well, I want to thank you both very much. Again, the website, as you see, is stopafib.org. Best of luck, and hopefully we've gotten some more information out to people. We'll be right back.